Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is evaluating a patient who is being treated for obsessive compulsive disorder with fluoxetine 60 milligrams daily. The patient has been on fluoxetine for months without any concerning adverse effects, but today the patient reports that for the past few weeks, she has had a distinct sense of agitation, racing heart, nausea, and has been really clumsy. Suspecting serotonin syndrome, the NP assesses for A, new onset delusional thought, B, constipation, C, irritability, or D, recent use of over-the-counter cough medicine. Suspecting serotonin syndrome, the NP assesses for what? And, again, this is an evaluation question. The patient is being treated for a condition and you are evaluating response to it, which apparently up until now has not produced any adverse effects. But now this litany of symptoms really is consistent with a textbook presentation of serotonin syndrome. And a patient who is on 60 milligrams a day of fluoxetine, certainly we have to consider that. So as you look at these four answer choices, suspecting serotonin syndrome, what do you assess for in this patient who has been on a high dose of an SSRI for months? We don't know how many, it just says 4 months without any concerning adverse effect. What would be the thing that now could precipitate serotonin syndrome? And the correct answer is D. D is the answer. Serotonin syndrome is most common when people are on high doses of SSRIs and then either concomitantly develop difficulty metabolizing the SSRI, like there is some new liver insult, maybe they've contracted hepatitis, or they're taking another medication that insults the liver, or they're taking a medication that interferes with metabolism via the hepatic system. So either there's the high dose of the SSRI along with some concomitant liver insult, or they're taking other serotonergic medications. Remember, SSRIs, serotonin is in the name, but there are a number of other medications that are serotonergic that in one way or another increase the concentration of serotonin at synapses. So in this circumstance, suspecting serotonin syndrome, you would assess for D, recent use of over-the-counter cough medicine. And if you didn't know it, this is a really good learning point, both for your boards and for your practice. One of the things that contains a serotonin precursor is dextromethorphan. Dextromethorphan is the suppressant in over-the-counter cough suppressants. When you pick up the bottle and start looking at the 2-point font of all the stuff that's in your over-the-counter cough and cold meds, the thing that actually suppresses the cough is dextromethorphan, and dextromethorphan is serotonergic. And it shouldn't be used by patients that are taking SSRIs. It really is one of those important patient education phenomenon. With most other medications that are serotonergic, they're prescription, and so we have some idea what's coming, or even if we don't, the pharmacist might, if the primary care provider tries to prescribe something that's serotonergic, the pharmacist can see the interaction with this 60 milligrams of fluoxetine. But dextromethorphan is readily accessible over the counter. And to add insult to injury, lay people don't necessarily know what the active ingredients are. And so I have seen it happen where a patient has a bad cold, they go to the drugstore, they buy something that says, oh, it's going to suppress your cough, thanks to dextromethorphan. They take it. It doesn't work, so they take twice as much. Or in some cases will go back to the drugstore and buy another product that says it's the best cough suppressant, and the patient doesn't realize that they all just have dextromethorphan in them. And so you can see people that are on SSRIs using excess amounts of over-the-counter cough suppressants and then develop serotonin syndrome. So have to watch that dextromethorphan. While extreme serotonin syndrome may lead to hallucinations, disorders of sensory input, seeing things that aren't there, feeling things that aren't there, delusions are not likely. Delusions are different. Delusions are a firm, fixed belief that something is true despite proof that it's not. It's not the same thing as a hallucination, and delusions really are not consistent with serotonin syndrome. Similarly, while serotonin syndrome, which is serotonin overload, might actually lead to diarrhea, it doesn't produce constipation. Remember, serotonin actually activates the GI tract. So nausea, vomiting, and diarrhea, they might happen with serotonin syndrome, but you really don't expect constipation. And irritability, although it is a very common symptom in conditions being treated with SSRIs, it's not typical of serotonin syndrome. In fact, people that are in the midst of a serotonin overload typically are not very irritable. Keep in mind that MDMA, Molly, ecstasy, whatever you call it, the club drugs are highly, highly, highly serotonergic, and people just have a really great time and feel great. They also usually vomit when they first take it or have, diarrhea or some other manifestation of GI motility. But after that, they are certainly not irritable. And so the bottom line is you really do not expect delusional thought, constipation, or irritability. But when you see that patient who's been on fluoxetine 60 milligrams for months and hasn't had any problem, and now they do, look for some other serotonergic drug to be newly introduced. And the dextromethorphan is a particular concern because it's available over the counter.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit fhea.com.